Varicose veins are enlarged, swollen and twisting veins which often appear red, blue or purplish in color. Mostly benign, they may turn painful and chronic if they are not handled in time. More than 25% of the adults are estimated to suffer from one form or the other of varicose veins, although women are affected in higher proportion as compared to men. Exact symptoms of varicose veins varies from person to person as it depends on the stage of varicosity. In this video, we will learn about what exactly is varicose veins, what are the symptoms and what are the major causes so that you can remove these causes and find relief from varicose veins. So let's get started. So veins are the blood vessels that return oxygenated blood back to the heart after it has gone through circulation. Our veins consist of several one-way valves. These valves only allow the blood to move upwards and they close down once the blood flows through, thus preventing backward flow of the blood. During good circulation, the muscular contractions of the leg muscles assist the blood in moving up. At the same time, any kind of physical activity or movement of the muscles squishes the blood upwards the vein. The valves allow the blood up and this is done at successive valves going up the vein. Now, varicose veins develop in different stages. We will look into how this happens on stage by stage basis and what kind of symptoms do you experience at different stages. So let's check it out. According to Ayurveda, one of the primary causes of varicose veins arises from poor circulation and an imbalance in Vyana Vata, which leads to increased blood pressure throughout the veins. Chronic condition in which the blood pressure is often higher degrades the condition of the walls as well as the strength of the walls of the veins. This leads to a loss of elasticity in the walls of the veins as well as malfunctioning of the walls such that they do not close properly, and when the walls do not close properly, the blood can flow backward or start clogging down, and when this condition happens, then your veins start to bulge out and they start to buckle under the pressure of the blood which is getting accumulated in the lower extremities. This is kind of stage 1 of varicose veins. It may happen in the veins which are deep inside, hence you may not experience any visible symptoms of change in coloring of the veins, but there may be other symptoms such as swelling, water retention, loss of sensation, tingling, light pain in your arms and feet that often comes and goes away, inability to stand for long hours, or there may be a slight discoloration or bulging of your veins. Now, if the condition is not handled at this stage, it may progress to the next stage in which the blood is still clogging up. Then this clogged up blood starts to find alternate routes and bypass the walls altogether. This clogged up blood then starts to go through the superficial veins. Now, the superficial veins are much closer to the skin and they have less muscular support to hold the blood and let it go upwards. This leads to typically discolored and or painful spider veins. At this stage, the physical appearance becomes prominent. Other symptoms that appeared in earlier stage may become more prominent and aggravated by this stage. Most of the people rush to the doctor at this point to find relief from pain or for purely cosmetic reasons. Now, if varicose veins are still not addressed, then it may progress to the next stage which involves inflammation, ulceration and extreme pain. In this stage, the clogged up blood in the venous cavity starts to deteriorate under the Ranjak pit. This happens when one develops pitta imbalance due to high heat or poor liver function. The blood thickens up due to presence of toxins or waste materials which are also called ama, which is also often the case for those who are suffering from varicosity of the veins. This further impacts circulation of the blood and aggravates the symptoms one may experience following discomfort such as inflammation, heat or extreme pain in the affected area, peeling of the skin, wounds and presence of ulcers, skin being prone to infections, and swelling or numbness of the area which is experiencing varicosity of the veins. So now you saw that varicosity of the veins is actually triggered by poor circulation and hence buildup of pressure in the veins. Now let's try to look into the factors that affect the circulation in the veins and functioning of the walls of the veins. So varicosity of the veins may be triggered by primary and secondary factors. Primary being the main reason because of which varicosity has happened in the first place. For example, excess weight, standing for long hours, or sudden change in the temperature of the body parts which are experiencing varicosity of the veins, especially the calf muscles or the legs. And secondary means that varicosity happened due to something else that made a patient prone to varicose veins. For example, hormonal changes in menopause and in pregnancy. Now let's try to understand what's happening with your vein. So here are the 4 primary triggers of varicosity of veins. Poor circulation in the veins, which leads to excess pressure and hence affects the functioning of the walls and of the venous walls. Valve malfunction due to weakness of the walls, which we looked into detail. Accumulation of toxins in the bloodstream, which actually affects the thickness of the blood and hence results into poor circulation throughout the body. It often leads to blockages and clogging up of arteries and veins as well. And poor strength of the venous walls, which may also result from aging and some other factors. Now you saw how varicose veins develop and what triggers them. So it's quite important to handle the condition of varicosity of the veins at the earliest stage as possible. This is because if you do not address the condition at the right time, the blood keeps on clogging up and the symptoms keep getting worse. Apart from the dietary and lifestyle changes, you can also take in some Ayurvedic herbs which actually promote circulation of blood, and adopt other measures such as heat treatment, regular movement and physical activity, or massage of the body parts which are experiencing poor circulation. There are several quick fixes and patches employed to treat the condition of varicose veins. Most of the time these treatments lead to recurrence of the health condition or they come along with the side effects. But with Ayurveda, you will be able to treat the root cause of the varicosity in your veins and hence find relief for good. Depending on your health condition, the relief may come slowly, but it will last forever. So the choice is yours to make. When you start making appropriate changes at the right time and prevent the onset of condition, you will find relief quickly. However, if you have waited, then it's still not too late. Start today by consuming foods that nourish you and adopting a lifestyle which is active and promotes circulation, prevents deposition of toxins in your bloodstream. So get started today. I hope you found it useful. Do write to me for any queries and I will get back. I'll see you later. Bye-bye.